Hello, wonderful parents and caregivers. Welcome back to our channel, where we share essential tips and advice to help you on your parenting journey. Today, we're focusing on a critical aspect of breastfeeding effective latching techniques for better milk intake. A good latch is key to successful breastfeeding, ensuring your baby gets enough milk and preventing discomfort for you. Let's dive in. First, let's talk about why a good latch is so important. A proper latch ensures that your baby is effectively drawing milk from your breast, which helps them get the nutrition they need to grow and thrive. It also prevents common breastfeeding problems such as sore nipples, engorgement, and blocked milk ducts. Here are some signs of a good latch. Your baby's mouth covers a large portion of the areola, not just the nipple. Their lips are flanged out, similar to fish lips. You can see or hear your baby swallowing. You feel a gentle tugging sensation, not pain. Your baby's chin is touching your breast, and their nose is clear for breathing. Chapter 2: Preparing for Breastfeeding. Before we dive into latching techniques, let's talk about finding a comfortable breastfeeding position. Here are some popular positions to try. Cradle hold. Your baby lies across your lap, supported by your arm. Cross cradle hold. Similar to the cradle hold, but you support your baby's head with the opposite hand. Football hold. Your baby is tucked under your arm, like holding a football, with their body alongside your side. Side lying position. You and your baby lie on your sides, facing each other. Find a position that works best for you and your baby, ensuring that you both are comfortable and relaxed. Now let's get ready to latch. Here are the steps. Position your baby. Make sure your baby's head and body are aligned. Their nose should be opposite your nipple. Support your breast. Use your hand to support your breast in a C-hold, with your thumb above and fingers below the areola. Bring baby to breast. Gently touch your baby's lips with your nipple to encourage them to open their mouth wide, like a yawn. Achieving a proper latch is crucial for comfortable and effective breastfeeding. You'll want to make sure your baby's mouth covers both your nipple and a good portion of the areola. The baby's lips should be flared out like a fish, and you should hear a rhythmic sucking and swallowing pattern. If you feel pain beyond a slight tenderness, gently break the suction with your finger and try again. Remember, practice and patience are key. Every baby and mother pair is unique, so take your time to find what works best for both of you. One of the most effective latching techniques is the asymmetrical latch. Here's how to do it. Wait for a wide open mouth. When your baby opens their mouth wide, quickly bring them to your breast, aiming your nipple towards the roof of their mouth. Chin first. Your baby's chin should touch your breast first, then guide the nipple into their mouth. Flanged lips. Ensure your baby's lips are flanged out and that they have a deep latch, covering a large part of the areola. If your baby has a shallow latch, you might feel pain or discomfort. Here's how to correct it. Break the suction. Gently insert your finger into the corner of your baby's mouth to break the suction. Reposition. Reposition your baby and try to achieve a deeper latch using the asymmetrical technique. Observe and adjust. Watch for the signs of a good latch and make adjustments as needed. Breastfeeding can be a rewarding experience, but it does come with its challenges. Here are some tips for successful breastfeeding. Stay hydrated and maintain a balanced diet to support milk production. Find a comfortable position for both you and your baby to make feeding sessions more enjoyable. Don't hesitate to seek support from lactation consultants or breastfeeding support groups. Remember, every breastfeeding journey is unique. Trust your instincts and be patient with yourself and your baby. Breastfeeding can take time and practice for both you and your baby. Be patient and persistent. Every baby is different, and it might take a few tries to get the latch right. Don't get discouraged. With practice, it will become easier. Respond to your baby's hunger cues to ensure they're ready to latch. Common hunger cues include rooting or turning their head towards your breast, sucking on their hands or fingers, smacking lips or making sucking noises, fussiness or crying, which is a late hunger cue. Feeding your baby when they show early hunger cues can make latching easier. A breastfeeding support pillow can help position your baby at the right height and angle for a good latch. Place the pillow around your waist and lay your baby on it, ensuring they are at breast level. This can reduce strain on your arms and back. Chapter 5: Overcoming Common Breastfeeding Challenges. Scene 1. Sore nipples. Host. Sore nipples are a common issue, especially in the early days of breastfeeding. Here are some tips to manage soreness. Ensure a proper latch to minimize friction. Apply a lanolin-based nipple cream after each feeding. Let your nipples air dry to promote healing. Scene 2. Engorgement. Host. Engorgement occurs when your breasts become overly full and firm. Here's how to alleviate it. Breastfeed frequently to empty your breasts. Apply warm compresses before feeding and cold compresses after. Gently massage your breasts to help milk flow. Blocked milk ducts can cause painful lumps in your breast. To clear a blockage, apply a warm compress to the affected area. Gently massage the lump towards the nipple. Breastfeed frequently, starting on the affected side. If you're experiencing persistent breastfeeding challenges, seek help from a lactation consultant. They can provide personalized advice and support to help you and your baby achieve a successful breastfeeding experience. Long-term breastfeeding success requires patience, dedication, and sometimes a bit of extra support. Remember, each breastfeeding journey is unique, and it's important to find what works best for both you and your baby. Keep going, and don't hesitate to reach out for help when needed. Stay informed by reading books, joining breastfeeding support groups, and seeking advice from healthcare professionals. Continuous learning can help you feel more confident and prepared for any challenges that arise. Remember that breastfeeding is not just about nutrition. It's also a wonderful bonding experience. Enjoy the special moments of closeness and connection with your baby. These moments are precious and create lasting memories. Thank you for joining us today. We hope this video has provided you with valuable insights into effective latching techniques for better milk intake. Remember, every breastfeeding journey is unique, and with patience and practice, you and your baby can achieve a successful breastfeeding experience. Don't forget to like, subscribe, and hit the notification bell for more helpful parenting tips. Happy breastfeeding! Subscribe for more tips and advice. Thank you for watching.